Welcome to the Dental Forecast. Join Dr. Craig Packer, Dr. Joe Field, and their incredible guests as they expand on the Gen 4 commitment to usher in the next generation of dentistry. Stay with us as we delve into cutting-edge techniques and discussions shaping the future of dental care, right here on the Dental Forecast.
All right, welcome everyone to the Dental Forecast, where we explore engaging topics at the intersection of current practice and the future of dentistry. I'm Dr. Craig Packer, joined by my co-host, Dr. Joseph Field. Hey, Joe, how are you today?
Great.
We're excited for this opportunity for us to get together for another episode.
Yeah, our guest is, this is probably the furthest away guest we've had geographically, so we're excited for that.
Yes, all the way from Spain.
Yes.
Yeah, that's amazing. Dr. Field, why don't you introduce Christian Coachman to us, and we'll ask him about his amazing journey in dentistry.
Yeah, I'll introduce the man that needs no introduction. So, everyone in dentistry is familiar with Christian Coachman. So just a little background on you, Christian. I know you graduated first as a dental technician in 1995, and then as a dentist in 2002. So really unique training and background there. You've been, really gained, I think, a lot of prominence with your work with Team Atlanta, how you've, collaborated with dentists worldwide and becoming a lecturer, a prominent speaker internationally and consultant. And really what has been personally most impactful for me is your development and really how the evolution of the digital smile design. And I'm going to call it an ecosystem because it's all encompassing from education to, even how to set up your consult room and then the execution of the clinical dentistry. And so super, super excited to have you on the podcast with us today, Christian. And thanks for, making time for us all the way in Spain. And I'd love to hear out of the gate, why DSD? Where did that come from and how did that develop?
That's a great question to start. First of all, thanks for having me. Always a pleasure to share insights and learn from each other and being connected to your amazing group. So thank you for the opportunity. And why DSD? So digital smile design comes, first of all, because of the dual background that you mentioned, right? Dentist and technician. By understanding both sides of the process, mainly the restorative process, but also the treatment planning process, from the lab perspective, from the clinical perspective, and having the honor of working with so many amazing dentists, I realized that being a great technician and being a great dentist was not enough. We were still making mistakes, redoing cases. Many times outcomes were not necessarily ideal. So many cases that we were doing, we were looking at them and saying, how can we do better? So basically DSD came from my internal process of always challenging myself and not settling, and trying to ask the tough questions about how can I do better? And I realized that the connection between the dentist and the lab, even though everybody, in the 90s were talking about the importance of a dentist-lab relationship, nobody was really exploring professional systems and processes to actually take this relationship to the next level. So I started from there. I basically started by questioning myself, what are the things as a dental technician, what are the things that are making me work more, have more stress, and making less money? And how can I improve the systems to make my dentist more happy and make the patients more happy and make me work with less stress? And I started to outline all the things that were keeping me awake, all the things that were unprecise, all the things that were not creating a consistent outcome, And I'm talking about working with great clinicians. So it was not be a better clinician. It was something else. If you are a great clinician and the other guy is a great technician, what do you do in between to become more effective? So I really was into effectiveness, and by outlining, asking the tough questions, challenging the status quo, and listing all these things, I started to try to develop solutions, and explore different ways of doing things, and that's how DSD started. One simple example, the Facebook, right? In the 90s when I started as a technician, early 2000s, if you were an amazing dentist, you were using a Facebook, and if you were an amazing technician, you knew how to use the Facebook in the lab, and still we had all the problems that the Facebook would bring. So my question was, what can be better than the Facebook? What are the reasons why we use a Facebook? Can we use something that is more effective to do what a Facebook does? So the first question that I was asking me was, what are the reasons to use the Facebook? And I started to ask even experienced dentists, and sometimes people didn't have a clear answer. Why exactly? But in a simple way, give me 2-3 bullet points. Why do you use the Facebook? And then I started to challenge the why, and then I started to look for new options. And many times I would find better ways to make that connection between the patient's mouth and face and the lab, and back and forth to the patient's mouth. So this is how DSD started. Ideas, and then my colleagues in the lab started to ask me, Christian, this is cool. Show me what you're doing. Dentists started to ask me. That's how the first course came out. People just show us the protocols. And I was lucky enough to have Facebook at that time just starting. I'm talking about 2007, 8. And I was one of the first ones to jump on Facebook and really use as a platform to share ideas and give lectures on Facebook. That was crazy in 2008, to give a lecture on Facebook. And it took off, went viral.
No, I'm pretty sure this was your first course you did in Las Vegas, and I was there. And we're learning on Keynote and PowerPoint, and it was awesome. It was revolutionary. But where are you at today with it? How's it evolved over the last 15 years?
Las Vegas was actually, I have a picture of Las Vegas course here on my wall. Las Vegas was the end of my what we call the first DSD World Tour.
Mm-hmm.
We did it in 2013, 14, and 15, where I literally traveled around the globe 2 or 3 times a year, giving this 3-day course. And at that time, as you mentioned, learning how to transform PowerPoint Keynote into a dental software was one of the highlights. Then how to use the digital ruler to measure things and transfer to the model. That was a big hit. How to develop your guided wax up, and then back to the mouth. Then we started to go into 3D software in 2014, and then printing the projects, and then the handmade wax up. I think you caught one of the last courses that I actually did a hand wax up live.
Yes, you did. That was pretty cool.
Yeah. It's still I still love the philosophy and the concept, and I think it's a great learning process for people to understand the analog way, right? To really take advantage of the digital later. But today, of course, everything is completely digital. So completely digital patient avatar, 3D data acquisition, cloud-based interactions, diagnostic planning, software simulation based on that wax up. But the concept of a diagnostic wax up and reverse engineering the treatment plan, it's still exactly the same, right? We're just doing it in 3D now with software, and then translating all these simulations into appliances, meaning that you want to deliver outcomes more similar to the plan. And that's the only way is through complete digital 3D workflows. That's where we are right now.
Did you, I'm assuming, Dr. Coachman, that you're still doing dentistry. You do dentistry how many days a week are you practicing?
No, I haven't done dentistry for the last 10 years.
Okay.
I never look. Even though I graduated from dentistry and I do have my dentist diploma in my wall, I was never a conventional clinician
Okay.
because I was already working as a technician when I finished dental school. And I decided to continue to work as a technician, even though I was a dentist. So I was a technician that was a dentist, but decided to continue to work for other dentists. And that allowed me to work with the patient of my dentist and collaborate in an equal level. So that type of work as a traditional handmade ceramist that was a dentist, helping my dentist to treatment plan and execute the treatment, and then coming back to the end and delivering the final ceramics. That model I stopped in 2014-15 when we went fully 3D and DSD really started as a company with the planning services and the lab services and so on. So nowadays I consider myself a digital lab owner, still doing quality control on all the cases that come out of the lab. So I'm still, I'm much more into training the technicians and quality controlling what they do before we ship to the dentist.
That's pretty amazing to go through. What dedication to go through all of those science classes and pharmacology and everything that doesn't even really relate so much to ceramics, right? You're learning about antibiotics and those types of things.
Pharmacology and all of this, yeah.
You went through a lot to be so specialized and to really understand both sides of what we do every day in dentistry.
I think, giving up on all these ologies was not that hard. I have to be honest. My passion, my passion was on something else. I know smile design became my passion. But yes, when I made that decision, when I finished dental school, everybody was like, okay, Christian, now stop doing technical work for other dentists. Treat your own patients. You're a doctor, make more money, you're going to have your own patients and so on. So people thought I was crazy when I said, "Look, I'm gonna continue to be a tech, just a technician, right?" But at the end of the story, it was probably one of the best decisions I ever made because my thinking process was, okay, I can become a good dentist, maybe even a very good dentist, but I'm gonna be just one more very good dentist in town. But if I continue as a technician, I'm going to be the only technician that is a dentist that consciously decided to continue to work as a technician for other dentists. And that was my first lesson on the power of differentiation, and how this generates the shortcut to really get where you want to be, differentiation. How sometimes more important than being even better is to be different, and being different on the perception of others and differentiating yourself became a big part even of the DSD concept and my lectures and so on. How do you differentiate yourself? Of course, that at that time when I made that decision, I'm 25, 26 years old, I didn't have all that figured out. I had an intuition that was probably a good decision, right? That something good would come out and I would become special on what I was doing. Another great thing that came from that was that the doors of the world opened, because as a clinician, you cannot work outside your country, as you guys know, sometimes not even outside your state. But as a technician, you can work, and if you're a good technician, you can work anywhere in the world. Every city has a dentist wanting a great technician.
Mm-hmm.
So I literally opened all the doors of the world, and I literally worked all over the world. I used to joke, I was a gypsy technician. My lab was in my suitcase for a few years, and I would go week after week from one top clinic in the world to another top clinic in the world and work with some of the best dentists in the world. Again, not as a conventional ceramist, but as a diagnostician, smile designer, treatment planner, patient, PR, relationship manager, all the way to the relationship with the orthodontist and the periodontist, beyond the restorative, and then all the way to the end, finishing with the ceramics, trying in, going through the emotions with the patient, and finishing the case.
So with on that vein of differentiation, which I think that's amazing, with the DSD workflow, it's different, right? And so could you walk us through that workflow from, we'll say initial consultation to final smile?
A couple of insights that I'm very proud of bringing, to our dental world. The first thing that I realized was that dentists have the tendency to plan before they design, when the ideal is to design your vision and then reverse engineer your treatment plan towards that vision, right? I started to realize that dentists were planning with whatever they had and then calling in the technician too late in the game, usually at the end. And I usually used to joke, I always felt like an architect hired after the house was already built, right?
Mm-hmm.
If you want me to help you design the smile of your patient, you need to call me in on the right moment. And that is before you even sell the treatment to the patient, because depending on how we design this vision, this will impact the way we sell the vision. So I started to get I was always very passionate about treatment planning, integrating function, aesthetics, biology, structure. That's what I learned from my father, also dentist. But I started to realize that if you don't do that on the right moment, it's never going to be ideal. So the DSD workflow starts with one very simple idea, that we need to focus on what we call the pre-case acceptance moment before post-case acceptance moment, where dentistry is completely biased towards post-case acceptance, meaning patient says yes, we start the treatment, we start dentistry. And my point was, no, the most important part of dentistry is before the patient says yes. That's where you collect the data. That's where you diagnose. That's where you communicate with your specialist. That's where you treatment plan. That's where you build your story. That's where you build your estimate. That's where you present to the patient and sell your case. Everything that I just mentioned happens pre-case acceptance. So DSD was heavily focused on how can we help dentists do better on the pre-case acceptance moment. And that brings us to our main teaching, that is around the first and the second appointment, where I believe is where the magic happens. The magic financially and the magic clinically, first and second appointment. Since 15 years, we've been talking about that. And still today, I believe that the revolution in dentistry needs to happen by reinventing our first and second appointment. First and second appointment in dentistry needs to be reinvented. And every time reinvented with a new layer, and nowadays the new layer is the body-mouth connection, the oral systemic link, complete systemic diagnosis, and all of these things that need to happen on the first and second appointment as well. So everything that is beautiful about dentistry, everything that is powerful about dentistry, it always brings us back into reinventing our first and second appointment. And very few talk about that. And I think that we need to focus more on that.
Yeah, that's amazing. So, Joe, I know you've used this workflow for a while now. So what would our doctors that are doing cosmetic dentistry but need to up their game just a little bit in that pre-acceptance workflow and different things like that need to have technology-wise in their office? This is for both of you, but I know, Joe, this is something you use all the time.
I mean, great photography, right, is super important. For us, a scanner, super important. And for us, a 3D printer is helpful. Not required, but very helpful. Those are really the three things that we need. What do you think, Christian?
Yeah, I think you summarized, pretty well. You have data acquisition in general. We need to expand. We need to expand the way we acquire information from the patient. So first, we need to become masters on oral facial data acquisition. That's the obvious. It is obvious, but if you go to any lab in the world, still today, most cases coming in don't have even the basic quality information, right? So basic diagnostic information, oral facial information, what we call the patient's avatar, right? You create the patient oral facial 3D structure in the lab. Actually, even before the lab, in the cloud. So cloud dentistry is the other thing that we need to master, right? And we need to understand what is cloud dentistry, and we need to leverage cloud dentistry. What it means leveraging cloud dentistry, it means that on that first, second appointment, you are not only using great technologies to acquire data, but we are organizing this data in a way that we can access anywhere, anytime, and share with other team players. And that means that we're going to take advantage of another powerful thing, that is collective intelligence, asynchronous communication, and better decision making. Too many decisions in dentistry are made alone. Too many dentists are making important decisions without leveraging the right technology and without leveraging the right collective intelligence, meaning allowing yourself to ask the right questions to the other specialists in the team, right? And getting the feedback before you present to the patient. So you need to acquire data. You need to have a system where you can upload every single patient to the cloud. You need to have a communication system that you don't waste time communicating with the specialists to be able to build a plan for the patient to come back and listen to it, right? You need to work with the lab that understands the new role of the lab. That's a key factor. Modern labs are starting to understand that they are not just there to help dentists manufacture devices. That's the old lab. The new lab is helping dentists to treatment plan. And to help a dentist treatment plan, the lab needs to leverage the software that they already have. And instead of using it only to manufacture devices, but to use it to simulate possibilities. Simulate possibilities before you have the answers, before you know the treatment. And generate visuals, because another factor in modern dentistry is visually guided decision making. You need to see visuals to make better decisions, right? Don't go crazy, on your ideas and then test drive them in the patient's mouth. If you can simulate your crazy ideas into a 3D software, you're going to make much better decisions. So collective intelligence, visually guided decision-making, asynchronous communication, a lab that understands how to create these visuals and send you back this information so you can look at things before you put the plan together. And then become a master on visual presentation to the patient. Because at the end of the day, if the patient doesn't say yes, somebody has to pay the bills, right? Somebody has to pay for this whole journey. So you need to become a master on making patients say wow several times and say, this is my dentist.
I know for years dentists, and maybe this still happens, hopefully not much, but dentists would just prep 8 anterior teeth, take an impression and send it to the lab. And the lab only has in front of them a model. They have no idea where the lip is, where the gums are, how the person smiles, if there's a cant.
And it's crazy, huh?
Yeah.
It's crazy to realize that this is still pretty normal. But this is, and you just explained the ultimate level of what is wrong, right? Or the missing opportunities, right? You are sending a case to the lab without the right information after you're already prepped.
Mm-hmm.
If we move backwards, right? What is the first step? Plan the case with your lab before you even prep.
Mm-hmm.
What about that? Isn't that obvious? To plan the case before you prep. The huge majority of dentists don't even do that. I'm talking about planning the prep, planning the restorative only with your lab before you start prepping. And your dentistry will be already in a completely different level, right? If you want to go even one step backwards, why don't plan the ortho with the lab, right? Why not plan the implants with the lab? So this is all what I call post-case acceptance, but it's already better than majority planning. It's what I call procedure planning. That's another confusion. People say, I treatment plan. I say, you probably are talking about procedure planning, not really treatment planning. People say, I use digital to treatment plan. My answer is usually, you're probably talking about procedure planning, not really treatment planning. You know, when you use CleanCheck to plan your ortho, you are procedure planning the ortho procedure. You are not treatment planning. Treatment planning, it starts from the face, it starts from the airway, it starts from systemic information, it starts with the end in mind. It comes from the reverse engineering of where you want to be with all the possibilities. Treatment planning means exploration. Treatment planning means exploring possible ortho, possible pros, possible implants, possible combination between all of them, possible crown lengthening, possible opening the vertical dimension, possible grafting, before you even know if you're going to need these things. This is treatment planning. So if you want to use software, and you need to leverage software to do treatment planning, because treatment planning is the most difficult part of dentistry. Executing is easier than treatment planning. And people don't leverage technology with treatment planning. People use technology to procedure plan, but not to treatment plan. So treatment planning with technology means that you're creating a patient's avatar. You're bringing this patient into the software, and you're starting with the right questions. Function, aesthetics, biology, structure, but also the face and the airway. And you're developing this possible diagnostic design, and then you're exploring. Say, let's try to simulate ortho. Let's see if it makes sense. No, forget about it. Let's try to open space and place more implants. Let's try to close this place and place less implants. Let's try to change the vertical dimension. Let's combine vertical with ortho, vertical without ortho. Let's bring crown lengthening into the game. Let's explore root coverage. Let's explore grafting. It's an exploration phase. And let's leverage technology, because doing this on the software is the only moment that you can make mistakes and press Command Z and go back, right? So it makes no sense for us not to treatment plan the patient digitally before we even touch them.
What, as you're out speaking with thousands of dentists and presenting this information, what are the biggest barriers that you see with adaptation for this?
That's a great question. So everything I just said is probably, it's cool to say these things, right? Because it's always exciting to say these things. And I know that great dentists like you guys, it's pretty obvious, right? So the question, I think I love your question, because if it's so obvious, why people are not doing it, right? Why? And the answer for me, of course, first and foremost, is to understand human behavior, right? We don't like to change. But then the question may be, but why we didn't start since ever doing the right thing? So we didn't have to change. We would be doing the right way since ever. So my one, there's probably more than one reason, but one strong reason here, going back to pre-case acceptance, post-case acceptance, everything that I'm saying is related to how to improve the pre-case acceptance moment, because that's where the magic happens. Diagnose, plan, and sell. Diagnose, plan, and sell, right? Everything you do to make this process better needs to come out of your pocket, because it's before the patient pays you.
Right.
That is, for me, the biggest reason why people struggle. So it needs to be part of a more mature business model. You need to really see the big picture. You need to understand midterm return on investment of why you are making this change and investing, training your staff, training yourself, investing in your lab, investing on your partnerships, investing on communication systems, investing on technologies, investing on your first appointment, investing on your second appointment, investing on your communication skills. All these investments, they need to come first from your pocket, believing that you're betting on the right direction and you're going to see the return. So usually, people don't have that clear vision or the courage to go for it. That's my take.
I think you're right, honestly. And it's what's the thing that you talk a lot about that's, again, different with this workflow is that the concept of emotional dentistry, right? And I think that's where there's a disconnect from what I see in how this workflow is most successful. And part of that is, we're clinicians, right? It's like, and to a certain extent, like we're dental technicians, right? And the emotional piece of this process is not something we're taught. For a lot of us, it's not innate. Like, how does that relate? How does that integrate?
That's a great next question, because why did I start to talk about emotional dentistry? Because as somebody that loves communication and was always trying to understand how to become a better communicator, I realized that everything I was saying was technically reasonable, maybe clinically correct. But as I said before, if the patient doesn't embrace it, it's impossible. It's not a model. It's not going to happen, right? So very soon in my lectures, I realized that for dentists to see the light at the end of the tunnel and put the energy on doing DSD, I needed to help them onboard their patients. Patients needed to become fans of the DSD workflow more than even the dentist. And I will put in between the staff. So first challenge for the dentist after my course was convincing the staff to embrace all these ideas. Huge challenge. Staff was not in the course. Staff was not inspired, not motivated, has no clue about all of this. And the dentist is back and saying, we're going to change all of these things. And everybody's like, are you crazy? Why? And even the staff members that were like, yeah, let's do it, behind the back, they were not doing. They couldn't see the why, right? So the first step for us was to help dentists onboard their staff. How can you make your staff see what is in it for them? If we make this happen together, your life is going to be better. Let me explain why, right? So onboarding the staff, leadership skills, how to make your vision become other people's vision. But then at the end of the day, you also need, most of all, to bring the patient. So the patient needs to become a fan of the journey, of the process. So emotional dentistry is the term I coined to explain everything related to the wow factor, everything related to making the patient love the experience, right? And it become a big part of it. So we would teach the treatment planning concepts, the technological concepts. We will teach the practical execution, staff onboarding, and we will teach patient communication. How do you make the patient realize that they are the luckiest patient for having you? And how can you make this magic happen in the first 1 hour, in the first 15 minutes? What do you do before they come? What do you do when you first say hello? What do you do on the first 3 minutes? Your words, your behavior, your staff behavior, everything counts on this experience. And this became, as you know, a big part of the course, the emotional dentistry concept. Basically, DSD is treat the planning concept, comprehensive dentistry, guided dentistry, and emotional dentistry. Comprehensive dentistry is the philosophy, is the treatment planning philosophy. Guided dentistry is the execution philosophy. And emotional dentistry is the patient onboarding philosophy.
I'm excited to learn more about those three concepts and how they intertwine and work together. That's really neat. Okay, so Christian, we just recently did We've done a podcast recently on AI. So tell me a little bit about how you feel about that in dentistry in general, and also, is this part of something that you're incorporating into your process and software?
No, 100%, 100%. AI became, for the last 2 years, our number one topic here in the company. First, as a company, how do you use AI, right? Not related to dentistry, but how do you use AI to run a company, to potentialize the team members, to improve efficiency, uh, to grow better, right? And of course, we are helping uh, dentists to understand how to take advantage of AI in their practices. When you talk about AI in dentistry, you have the obvious topics, basically how AI is already helping you with reading an X-ray, right? So that was the first layer, radiology analysis through AI, from panoramic to X-rays to now CBCT analysis, and that is fantastic. The next layer is how AI is impacting dental software. So every other month, companies are making the software easier to use by leveraging AI to improve certain steps. AI is not doing full smile designs by itself. AI is not designing full rehabilitation arches by itself, but AI is already lining up files better. It's already fine-tuning occlusion better. It's already defining interproximal context better. It's already setting the teeth for an initial setup automatically, and then you have less work. So steps are becoming easier and faster through AI. AI is already designing single crowns. Quadrant dentistry will be completely substituted by AI as in mainstream very soon, meaning every dentist will prep teeth. If you're not involving the smile design, if you're not changing the bite, if you're doing quadrant dentistry, posterior, lower, upper, lower, lower anteriors, you're gonna prep the teeth. AI is gonna tell you if the prep is good or not. You're gonna prove it. It's going to take a few seconds. The design is going to come back, and you're going to print or mill chairside. Some systems are already doing that. That's a reality. So labs that are basically many labs out there, 70% of their business comes from quadrant dentistry. So that's going to be a big change, right? Labs will be forced to actually focus on what really matters: smile design, relationship, treatment planning, diagnostics, really supporting the dentist with the things that AI will take longer. Of course, we're going to start seeing AI giving suggestions in terms of treatment planning. We already see some solutions. They're just starting. It's still solutions on quadrant, segmented, fragmented situations. And of course, you can already envision that in the future, I don't know if it's 5 years, 10 years, 15 years, you're going to take your patient's avatar, throw it into AI, give the background of the patient, feed with as much information as possible, and AI is going to use all the know-how to give you the suggestions. This is an ortho case, yes or no, complex ortho, simple ortho, surgically facilitated ortho, orthognathic ortho, ortho restorative, which teeth this is coming, right? Probably will take several years still, but it's coming. But today, what I think every dentist should immediately start taking advantage is on management processes, communication processes, to leverage AI. Every communication should be recorded and should be improved, summarized, and shared by AI. Every appointment, you can use AI to give information to the patient as soon as they leave. Using AI to improve your communication with the lab, to understand what is going on and improve your words and the way you express an issue, right? And the way everything is documented, so you can go back and find the discussion from last year, and even better, ask AI to summarize what happened with that patient for the last 1 year, so you can have more context to make a better decision today. All of these things are already possible today with non-dental solutions. And I think that every dental practice should take advantage of it immediately.
It sounds like there's going to be a big, I don't even know how to say it, almost like a seismic shift in dentistry. And I've already seen so much change since I graduated in 2000, but I think this is going to be exponential as it comes on board in the next 10, 15 years.
It is crazy. We all know, right? We can feel it. We can feel that something that we cannot even explain, it's about to happen, right? In the world of doing your job, in 5 years, you can only imagine what is going to become doing your job. Good things about this in dentistry is that being a dentist will still be extremely necessary.
Mm-hmm. Right. Yeah.
Some professions will disappear in 5 years, I can tell you. Some certain things, will become completely obsolete. Will become obsolete in 5 years. Being a dentist, for sure, not even close, right? But the way we leverage AI, what I tell the team, because it creates anxiety, it creates fear. We all feel overwhelmed, Even myself, I consider myself very open-minded, very positive, optimistic, whatever, I feel anxious. I feel like, what the hell, right? What's going to happen? AI is going to probably give my lectures much better than myself, for sure, right? And will even create the new lectures, right? Better than myself.
So in the dental lab space,
but just to conclude, Joe, on the AI, one thing that I try to say to myself to feel more calm is like, think about AI as your best friend. Think about AI as a partner that you always dreamed with. Somebody that can always bring you great information, can help you think, can help you explore. That if you are very good feeding the right questions, the sky's the limit. So for the team, I say, look, AI is going to become a team member. It's going to be you, it's going to be your colleagues, it's going to be your client, it's going to be the technician, and it's going to be AI. AI is going to be there, commenting, suggesting, interacting. Don't feel afraid. It's such a good friend that, of course, you're going to want this friend to be close to you. Just be close to the friend, right? And the closer you get, the more friendly they become.
That's an interesting way of looking at it. I love that.
Well, Christian, I mean, one of the most, I guess, almost sought after roles in a lab right now is dental designers, right? Digital designers. They're hard to find. How is AI going to change that? And is it going to make designers' role obsolete or completely different than what it is now?
What it's going to do is that it's going to allow people with artistic skills that have no time to actually be able to do it, right? And that is every good restorative dentist with great artistic skills, right? Because AI is going to just do the hard work and allow you to just fine tune and put your touch on the design and so on. It's going to allow the good designers, the good technicians, the good CAD designers, the few, to be able to serve more dentists. So we're going to solve that problem, right? Through AI, because it is a shortage of people saying, I want to be a technician. In US is huge. Nobody wants to be a technician. Nobody wants to be a CAD designer. Nobody that has artistic skills say that's my choice. Very few. And that's a problem. So the ones that are doing it will be able to do much more and for more dentists. So technically speaking, we're probably going to have less of a problem.
It's exciting.
Yeah, it is exciting. Well, good. Well, I know we've taken a lot of your time. There was just a couple quick little, maybe short questions with just quick answers that I thought would be kind of fun. So, first of all, what is one common mistake that you see dentists make in their preparations that just frustrates a lab? And I don't know if it's, I mean, one of the things I'm wondering about is, I don't want to answer it for you, but you've seen both sides of a lot of different things. So if you could just yell at a dentist or a 250 dentists and just say, please do this, what would you tell us?
Never send a prep to the lab that you wouldn't approve on your own mouth.
That's a great one.
You look at the prep and the scanner is giving you the golden opportunity because it's bringing your prep in all kinds of visuals, huge, right in front of you on a screen, while your patient is still in your chair without the provisional. So how can you have a better opportunity to analyze what you just did, identify what needs to be improve, and then rescan?
I think there's been this interesting thing in dentistry. My brother's a lab technician. There's an interesting thing in dentistry where dentists love to blame the lab when something doesn't fit right or go right. And we're like, oh, they made a mistake again.
Look,
and the labs just swallow it. You just take it.
We make mistakes in the lab 100%. But, it all starts with the information that comes in. And I can tell you, dentists that really cares about the detail, they put the energy. It's not necessarily being the perfect dentist, but caring about, I looked, I saw it, and even if for any reason you cannot improve it, to acknowledge it. Don't pretend that the technician will not see it, right? Just be one step ahead and say, I'm sending you this. These are the issues. These are the reasons why I couldn't fix these issues. And this is how I believe we can overcome these issues. That's my suggestion.
That's right? Great.
So, yeah. And look, because that's the beauty of digital. There's no gray zone. It's black or white. If you don't see something on your scanner, we will not see it in the lab. There's no magic tool in the lab.
They'll just show up for you guys.
That big flap of tissue doesn't just go away from the margin.
They are creating technology that will see through the tissue.
Wow.
That will see through the tissue. Yeah. And this is going to come fast. Scanners that can see through the tissue and can scan the margins, even if they are subgingival and even if the tissue is on top of it.
Wow. I didn't know that.
That's great. But still, you're going to need to understand where you position your finishing line according to the gum, according to the biological width, according to the emergence profile, according to the aesthetics. You're still going to need a prep that has clearance, that has no sharp angles, that has path of insertion, no undercuts, a prep that allows us to design the best relationship with the gum, a prep that allows us a profile to create ideal function. That's the reason why, and I already listed the most common 5 issues with preps. That's why you should always talk to your lab before your prep. Every time you schedule a patient to prep, send the pre-prep information to your lab and tell your lab, give me all the insights so I can prep ideal for you. This patient is coming back next week. I'm going to prep.
Love that.
This costs zero. It's zero cost. It's going to make your lab feel so empowered, they're going to care much more about your cases. They're going to give you insights many times that are very valuable and will take your preps to the next level. And you're going to create a relationship that is going to take your work to the next level.
That's brilliant. Well, Christian, it's getting late in Spain. I have one last question for you, and then we'll let you get home and get to dinner. So docs listening to this, and they're like, "Man, I want to like start the journey here. I want to get involved in this, learn more about DSD. What's the first step? What should they do out of the gate to get going?"
We have our DSD concept. The 3-day course became an online on-demand course. And you can either watch this course by itself or purchase our in-person course, DSD Provider. The DSD Provider is a 2-day course that explains exactly how to start doing all of this, even with your own lab. Even though we are a lab, we would love to work with dentists, but our goal is not like, oh, you need to use us to make it happen. No, we want you to make it happen with your lab. We want to help you with that. So the DSD Provider course is our main course, and it does come with the DSD concept on demand connected to it. So you have hours of on-demand content to watch first, come in person 2 days, and we're going to share everything we can about all of this. And then you can use our services as a starting point to realize who next to you can start doing that for you.
Love that.
I love it.
Well, if I could make a final plug, Christian, and I've been harassing some people there on the DSD side. We would love to get an in-person course back on the west side of the United States, whether it be Vegas or San Francisco or something. We got a lot of people out in the West Coast.
You can give me a date right now, and I can confirm right now. You guys have an amazing group. We can customize something for your group. Would be a huge pleasure to be able to bring this to your dentist, to your clinics, to your labs, because we believe in this so much. We want this to become the best way to go forward.
It's the standard, in my opinion.
That's amazing. One of the things Joe and I do with the company is help with clinical skills and development. So we'll be reaching out. We'll make that work.
Yeah.
Count on me.
All right. Sounds great. Well, we're so grateful, Christian, for your time. Your power just came back on right before we hit record here. It was perfect timing. We appreciate everything that you've done for the industry, for dentistry all across the globe.
Yeah, thank you.
A pioneer in what you do.
Thank you. Thank you. Thank you for your kind words, and hope to see you guys soon in person.
That'd be great. All right. Well, thank you, everybody, for listening to another great episode of the Dental Forecast. Many more to come. Everybody have a good day. Thank you.